Hi, I'm Dr. Chuck with Your Filthy Mouth. You think your mouth isn't that important? Think again. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, welcome to Your Filthy Mouth. I am Suzanne Lynn with Dr. Chuck Reinertsen. And oh my goodness, we just have to start the show off with some amazing news that we just recently got.
Yeah. Many communities have something called TED Talks, and Eustis has TED Talks. And there are many applications that go in to present, and we're fortunate to be chosen as one of the presenters for TED Talks Eustis, which is going to be filmed in January 2020. So we're looking forward to it.
We are very excited. Yeah. And the cool thing is that this episode, we're going to dive in a little bit to what that talk is going to be about.
Well, the theme is think again. And there's so many things that we just kind of assume, but they want you to, let's think again. And when it comes to the mouth, you think it's just something, it's your pile, it's what you eat from, you know, right? Think again. There's a lot more that goes into it. So, physicians, when you look at the mouth, let's think again. This is the front door of the whole body.
So really, I mean, everyone's invited, but it'd be wonderful if we could get some physicians specifically out there.
Yeah, absolutely. And the seating is limited, but it'll be filmed, so you'll be able to look at and see what the message we're trying to get across.
What is that message? What is the main mission that you're on with these shows?
Trying to connect the dots between what happens in the mouth and what happens with the rest of the body. I mean, it's so much more than just something you eat with and talk with and breathe through. There's you've got three things. People think about the mouth, you think about smiles, chewing, and speech. But there's three things outside of the mouth that are affected by the mouth. Number one is infections, either from the teeth or the gums.
Okay.
They get in the bloodstream, they affect the whole body. Number two is the airway. We've got to be able to breathe well. You know, if you're not getting a good night's rest, if you're not sleeping well, that affects your health overall. And the third thing is your bite, your occlusion, the way the teeth come together. That can affect all kinds of things, from headaches to neck aches and a lot of other issues like that. So it goes beyond just smiles.
All right, let's start with number one, infections. What's important for us to know? What's kind of a flyover for infections?
Infections don't have to hurt. Let's start with that, number one.
Yeah.
This last week, I had a physician who was in the chair, and we did regular x-rays, what we do to check and see what's going on, and he had 2 abscesses going on down here. Now, it could have been trauma that happened years ago, but for whatever reason, there was 2 teeth that had abscesses. And we talked to him about, well, we really need to take care of this. You need a couple of root canals, which, but he said, but they don't hurt. And it's nice talking with a physician when you're able to say, well, high blood pressure doesn't hurt. Diabetes doesn't hurt. Glaucoma doesn't hurt.
You're speaking their language.
Cancer doesn't hurt, and you still just want to ignore it.
Yeah.
He's like, oh, man, but it doesn't hurt. I said, I know. I know. That's the big thing. So the older I get, the more I like pain. Like I said, I never want to produce or give it.
Right.
But it's the best motivator I've found. So I kind of wish that he had a toothache down here, because he would have wanted to get him done even sooner. But that's one of the big things about most dental infections. They have no pain.
It's almost a curse that there's no pain with them.
Well, just like high blood pressure, diabetes, the other things. You wish that you would have some type of a signal, a red light flashing that says, hey, take care of this. But again, most oral infections have no pain. Now, they've shown that the bacteria from gum disease is causative for cardiovascular disease. And if you look on the links that we have on the page, it brings you right to the research that shows this. So this is not stuff we're making up. I mean, this is reality. So we sometimes need a reality check.
Yeah.
But so the bacteria in gum disease are causative for cardiovascular disease. Some of the researchers believe that between 40 to 50% of heart attacks are triggered by oral infections. That's a big deal.
Yeah, it is.
You got 600,000 deaths a year in the United States from heart attacks. That's horrible. If 40 to 50% of those are triggered by chronic oral infections that have been going on for decades, there's no pain, but yet you're dumping pus into the bloodstream, that's 300,000 deaths.
Wow.
There's 50,000 deaths a year from pancreatic cancer. That's horrible.
Yeah.
There's 300,000 from preventable heart attacks, because all of these infections, they're preventable, and it's not expensive. It's stuff that you can do at home for free, and that's the whole thing we're trying to get across is dental care is not expensive. Dental neglect, that's very expensive.
All right, the second point you brought up was the airway.
Yep, breathing.
Yes.
So a lot of times people, they snore. They're not getting a good night's rest. there are different things that can cause sleep apnea. One of them is if your brain is telling your lungs is not telling it to take a breath, that's called central sleep apnea. That's not okay. And the oral appliances that we make for obstructive sleep apnea aren't going to help. But central sleep apnea is the exception. The majority of them is called obstructive sleep apnea, where a lot of times you got some type of obstruction keeping the air from going down. It can be big tonsils. It can be sinus issues. It can be a thick tongue that's falling back when you lay back. A lot of times, as you put on some weight, you get a little bit fat all the way around that area. Well, that's making the airway narrower. And so the idea is you need to open up that airway to let the air go through. And it used to be that a CPAP was the only solution for that. Well, a CPAP will work great if you're going to wear it.
Right.
And if you have severe sleep apnea, which is you're stopping breathing 30 times or more per hour
Wow.
for 10 seconds
That's
or longer.
scary.
Okay. Yeah.
For how long?
10 seconds or longer,
Okay.
30 times an hour. That's severe. Well, they want you to try a CPAP first, which is absolutely, that's the gold standard.
Right.
But if you can't wear it, if you're not wearing it,
They're cumbersome. They're
you're claustrophobic.
Yeah, oh, sure.
And it dries out your mouth for some people. So then they have oral appliances that actually bring the lower jaw forward, open up the airway, and allows you to breathe better. So that's a great thing right there. If you have early to moderate sleep apnea, you can actually start with the oral appliance.
Okay.
So that's the second thing right there. So you have infections, which again, 90% don't hurt. So how do you even,
How do you know? You've got
how
to
do you know
get
you got
checked,
it?
right?
This is why oral examinations are so important. Like the physician, without those x-rays, without the radiographs that we took, he never would have known. We
Right.
never would have known those infections going on.
And all that pus might be going through his bloodstream.
That's exactly where it's
Right.
going.
Yeah.
I mean, the pus either drains out or it drains in. If it drains out, you see it. You clean the wound. When you pop a pimple, that's pus. But imagine that pimple pus going inside,
That's what's happening.
going into your arteries, working its way to the heart, to the lungs to get oxygenated, back to the heart, and then it's pumped everywhere in your whole body. And this is going on not just for days or weeks. This is literally decades and no pain. So this is why we're trying to bring everyone's. Let's think again. Let's think again about what's, the importance of oral health.
All right, so number 1's infections, number 2 is breathing, and number 3 was your bite.
The bite, the way the teeth come together. A lot of times, for years, we've gone to the dentist and they put a filling in or a crown in, and you have you bite down on that blue paper.
yeah.
Say, how does it feel?
Yeah.
Well, and they wait until you say, that feels good.
Yeah.
Well, there's a couple of things. Number one, if you're numb, it's really
sure.
hard to answer. That feels fine.
Right. Drool coming out.
Yeah. So when you get all the feeling back, sometimes you say, it doesn't feel just right. So you go back to the dentist and they could do some adjusting on that. But just because it feels okay doesn't mean it is okay. A lot of times we have these interferences that we kind of adapt to.
Right.
And I'll never forget, this is several years ago, I brought my wife into the office. I said, we're going to check your bite. And she goes, there's nothing wrong with my bite. I said, well, humor me. Let's check it. So we checked her bite, and there was some interferences. She said, but it's fine. It feels good. I said, well, can we go ahead and do some adjusting? And she said, well, okay. So I adjusted her bite when we were done. I said, now, how does that feel? She goes, oh, that's very different.
She didn't know what she didn't know.
You adapt.
Yeah.
You get so
Yeah.
used to it.
Yeah.
This is it's normal to you. Well, that might not be healthy. So we were able to eliminate some of the interferences she had in the back, and she said, I can actually chew my food better.
Oh,
And-
wow.
Yeah, because again, now the teeth are coming together like the gears that are designed to mesh. A lot of times if someone's had orthodontics, you've had your teeth moved around. Teeth are humps and hollows. Well, they've got to come together just right. If they're not coming together right, you're going to be banging on teeth. You can be breaking teeth. You're going to have sensitive teeth. A lot of times the orthodontist will give you a retainer to keep the teeth in the place. Well, if the gears are meshing the right way, the teeth should pretty much stay in place. But if they're not meshing right, you got humps and hollows. And if you're hitting the wrong way, you're going to be moving the teeth around more. So again, they want to get the bite right.
Which affects your jaw and headaches. And,
Absolutely.
Yeah, right.
Again, you got three things. You got two jaw joints and a bite, and all three should work in harmony with that. So anyway,
Wow.
it's infections from either the gums or the teeth. It's the airway. You've got to be able to breathe. Even, if you've got your partner snoring, or especially if you got to nudge them to wake them up at night, or get them to start breathing because they stop breathing. Yeah. That's not okay. And the third thing is the way the teeth come together. So if you think your mouth is a whole lot, is not all that important, think again. That's the thing we want to do. Think again.
I love it. All right. Well, we're going to do the question of the week. We're going to come back with some ways to prevent some of the problems we just talked about.
Fantastic.
All right.
Here's Dr. Chuck's question of the week.
Hey, this is Toby. I hear you talk a lot about disclosing tablets. I used them as a kid, but should I use them even as an adult?
Welcome back to Your Filthy Mouth. And Toby, great question about disclosing tablets. And actually, we've got a really, it's a fun example at yourfilthymouth.com on disclosing tablets if you want to go and see them in action.
You were a really good sport. I
got to tell you, I tried to find a lot of people to do it instead, but we couldn't. And I'm glad I did. It was really, it actually showed me where I was missing. But
you don't know what you don't know.
Right.
And disclosing tablets are fantastic. And you can pick them up. We got a link on our site to get it. You can get it on Amazon. You can either use the tablets or the solution. All it is a dye. And plaque is the same color as teeth. So when you brush your teeth, when you floss your teeth, when you irrigate, when you do all that, how do you know you got all of it off? Well, reality, you don't know. Okay. And that's why the disclosing tablets or disclosing solution is so important. So clean your teeth as good as you possibly can. Chew one of the tablets up. Use the solution, put it on a Q-tip, rub it on your teeth, but now you can stain that plaque. So now you can see, because this is the bacteria that's getting into your bloodstream. This is the bacteria that's going to the heart valve. This is the bacteria that's affecting your diabetes. This is the bacteria that they're finding in Alzheimer's patients in the brain. If we can head it off at the pass, we can focus on treating the symptoms, or we can get to the source.
I like that.
And that's what we're trying to do. Let's get to the source. Let's get to the front door of the whole body, which is right here. And how do you know it's clean? Disclosing solution is fantastic. So I'm a huge fan.
I was going to say
that.
you're a big believer in that. And actually, Toby's question is a great segue into wrapping up the show of what can we do to prevent the problems, the infection, the bite, and the airway. Right. Right.
Three things.
Right.
Yeah.
What are three things that we can do to kind of get us in the right direction?
Well, the first thing you can do is on the infections is make sure you're getting a thorough oral examination from a qualified dentist. Make sure you're getting the proper x-rays to see, not just the bite wings that show cavities in between the teeth, but see the roots of the teeth, because so many times we'll see abscesses that are going on that have absolutely no pain, but yet, again, you're dumping pus into the bloodstream. So get a thorough examination on that so you can find, make sure that you don't have any infections going on, either gum or tooth. Second thing is do what you can to keep them clean. Brush your teeth, floss your teeth. I tell people it takes 5 to 7 minutes to properly clean your mouth. And I would much rather have you take 5 to 7 minutes one time a day and do just a really good job than do a poor job 2 times, 3 times, 10 times a day, because you keep missing the same places. So if you can get in there and spend that time one time a day, if you want to do it twice a day, man, that's gorgeous. That's fantastic. But that's the number one thing you can do as far as infections is get those things cleaned out on that. So do a great job and check yourself. If you take a test and it's never graded, how do you know how good you did?
And it's the same thing with the third point with the bite. Go in and get checked just to see. Make sure you think it's fine, but like your wife,
Yeah, she thought it was fine.
Yeah.
But we put the TEC scan is what we use, which is a computerized bite analysis. We use that, and we're able to see exactly what was going on. And again, she didn't realize it was off until we fixed it. And I was like, oh.
That's so much better.
Yeah.
Well, Dr. Chuck is here in Lake County in Central Florida. If you're anywhere, the most important thing is to share this information with friends and family. But if you're in Lake County or Central Florida, Dr. Chuck can take really good care of you at Lifetime Dental. But we thank you so much. And again, some of those things that we were talking about, disclosing tablets, you'll find at yourfilthymouth.com.
Get on that. Yeah. And the sleep part.
Yeah.
The sleep apnea. You need to get checked on that. If you're having to nudge your bed partner because they stop breathing, that's not okay. That's, and I had a buddy of mine, this was back in the 80s, who's 37 years old, just didn't wake up. And so these are important things.
Yeah.
This is, like I said, it's think again. If you think your mouth isn't all that important in your life, think again. And if you think your mouth isn't part of your body, when you go to work on Monday, leave your mouth at home.
I love it. Dr. Chuck, thank you. Have a great one.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.